Good morning, Jones. My name is Mihira. I'm your invigilator for the OET-speaking session on the 6th of June 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Thank you. What is your full name for the record?
My full name is Jones Hope.
And what is your candidate number, please?
My candidate number is 251825828.
All right. Are you taking this test as a nurse?
Yes, I am.
Okay. Can I see your ID, please?
Sure. Here it is.
Okay. Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right, Mihira.
Why are you interested in pursuing a career in nursing?
My mother was a very compassionate woman who cared for my father when he got sick. He moved to a nursing home when she could no longer care for him. I was deeply inspired and motivated by how the nurses took care of my father and how it affected my family. Those nurses showed a genuine interest in my father's well-being, and knowing that I could make a difference in someone's life makes it all worthwhile.
What qualities do you possess that make you a great nurse?
As a nurse, I am committed to prioritizing compassion and care in my interactions with my patients and colleagues. I understand the importance of effective communication within my team, and always strive to show courage when presenting concerns to doctors and more qualified colleagues. I'm committed to a career that involves continuous learning, and I'm confident that the qualities I bring will help make a difference in the lives of others.
What methods do you use to prioritize tasks while maintaining outstanding patient care?
At the beginning of every shift, I make a to-do list with the day's tasks. I put the most important things at the top of the list, such as administering medications and reviewing patients' charts. Other tasks that I hope to get to will be at the bottom of the list. The job can be stressful at times, so staying extremely organized is the best way to handle it. This allows me to stay calm and remain focused on the tasks at hand when unexpected situations occur. During my rounds, I make sure to build a rapport with my patients to understand their needs better. This allows me to give attention to more serious patients and minimize mistakes.
How well do you work as part of a team of healthcare professionals?
I really enjoy working as part of a team, as I find that different viewpoints help me find solutions to a problem that I may not have been able to resolve myself. I take pride in my flexibility and understand that cooperation is crucial to problem solving. I also believe that respecting my coworkers is of the utmost importance, and I have no issues with taking orders from doctors or senior nurses. In fact, being part of a team motivates me to become a better nurse. My main focus is helping my patients, and I know that multiple perspectives can bring about creative solutions.
What are your strengths, and can you substantiate it?
My biggest strengths are my compassion and my ability to solve difficult problems. There was this one old man who had night terrors. He'd wake up screaming every few hours. I thought about how I would feel if it were me instead of him. I took some time to talk to him. I quickly found that just 10 minutes of conversation took away his fear. I came in early for the next 5 nights to spend time with him. His night terrors left, and the other patients on the ward could sleep peacefully again.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihira.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-play card if you want to. Here's a pencil for making notes.
Thank you, Mihira.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hello, good morning. I'm Jones Hope, one of the community nurses from the health center. Am I talking to Mihira?
Good morning, Jones. Yes, I am Mihira.
Nice to meet you, Mihira. Well, I am here to check on you after your head injury.
Nice to meet you too. Thank you for coming to check me out.
My pleasure. Mihira, how are you feeling today?
I'm feeling okay, I guess. But I'm a bit dizzy and confused.
I'm sorry to hear that. It would be helpful for me to assist you if you could tell me in detail about your difficulties.
Yes, sure. It started after I woke up following the accident. I was in the hospital then. The nurse told me that it will be all right soon, and I will be back to my normal life gradually.
Yes, normally. That is what usually happens. Well, Mihira, have you experienced anything like this before?
Not really. This is the first time I am experiencing this.
All right. Thank you for your information. Mihira, don't worry. As your hospital said, what you are experiencing is normal to have in this situation. It should improve over time.
I hope so. It's very frustrating to forget things.
I understand how you might be feeling. Is there anything that you're particularly concerned about?
Well, yes. I'm worried about my job. I work as an accountant, and I need to remember numbers and details.
I see. How long have you been working as an accountant?
For about 20 years.
And have you ever had any problems with your memory before this accident?
No, never.
Okay, that's good to know. It means that your memory loss is likely temporary and related to the trauma. Consider this as a normal injury everyone used to have, which will be healed after a while and function as normal afterwards.
Really? That's a relief.
Yes, it is. However, it may take some time for your memory to fully recover. You may need to take some time off work and rest your brain.
How long do you think it will take?
Mihira, your question is reasonable. But it's hard to say exactly. It depends on how severe your injury was and how well you heal. But usually, it takes a few weeks to a few months.
That long? Oh, no.
Unfortunately, yes, sometimes it can take that long. I know how hard it might be for you, but don't worry, we will help you along the way.
Thank you for your words. And how will you help me?
Be relaxed, Mihira. I can explain it in detail, so that many of your concerns will be clarified.
Yes, all right. You may please.
Well, first of all, we will monitor your progress and make sure you don't have any complications or infections. We will also give you some tips and strategies to improve your memory and cope with any difficulties.
Tips and strategies? Like what?
Mihira, I will explain it, so that you will get a very good understanding of it. For example, we will teach you how to use reminders and notes to help you remember things. We will also suggest some activities and exercises to stimulate your brain and keep it active.
That sounds helpful.
Yes, it is. By the way, Mihira, in this situation, it would be great if you have someone to look after you. May I know about the support you have at home?
Nurse, I live alone. There is nobody to take care of me.
I understand your situation. Do not feel helpless in this situation. We will deliver the maximum support from our side for your betterment.
Thank you for your kind words.
Beyond the things I have mentioned, we can also provide you with some support services if you need them.
I would like to know what kind of support services you are talking about.
I appreciate your willingness to know more details. Well, for example, we can arrange for someone to deliver meals to your home if you have trouble cooking or shopping. We can also offer you some counseling sessions if you feel stressed or depressed about your situation.
That sounds nice.
It is. Mihira, we want to make sure that you have everything you need to recover and get back to your normal life.
Thank you very much, nurse. You're very kind.
You're very welcome, Mihira. I will make all the necessary arrangements you need. In case of any assistance or queries, always feel free to talk to us.
Of course, I will. Thank you.
You're doing great so far. Just keep following our instructions and take good care of yourself. I wish you a speedy recovery.
Thank you, nurse. That's the end of your OET-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.